Intro and AMP, hook. So, you just stared at a positive pregnancy test, and now your brain has about a million tabs open with questions about the wild things happening to your body. Your mind is racing, and let's be honest, you probably have a few questions you're a little too embarrassed to ask your doctor. Well, in this video, we are going to tackle the top 10 most common questions from the first trimester, so you can feel more informed and a whole lot less anxious. Section 1. Morning sickness. First up, the classic sign of pregnancy, morning sickness. So, what's the deal with it, and when does it kick in? This symptom, which is basically nausea that may or may not include vomiting, usually starts between the 4th and 6th week of pregnancy. It's all thanks to a huge surge in hormones, especially HCG and estrogen. And despite its name, it can strike any time of day. For most women, it gets really intense around week 9 or 10 and then, thankfully, starts to fade as you enter the second trimester. To get through it, try eating small, frequent meals and keep some bland crackers by your bed. Staying hydrated and sipping on ginger tea can also be a game changer. Section 2. Breast tenderness. The next question on everyone's mind is, ouch. Why are my breasts so? This is actually one of the earliest signs of pregnancy, sometimes starting just a week or two after conception. Your hormones, progesterone and estrogen, are on the rise, and blood flow to your chest increases. It's your body's amazing way of prepping for milk production. While the tenderness and feeling of fullness can be a pain, wearing a comfortable, supportive bra can make a world of difference. The good news? This symptom usually chills out after the first trimester. Section 3. Extreme fatigue. Feel like you could fall asleep standing up? That bone-deep exhaustion is incredibly common in early pregnancy. Your body is doing a mind-blowing amount of work right now. It's building a placenta, your blood volume is increasing, and the hormone progesterone is shooting up, all of which can totally drain your energy. It's your body's way of screaming, slow down. The best way to handle it is to actually listen. Try to get to bed a little earlier, and if you can, sneak in a few short 15-minute naps. A little gentle exercise, like a short walk, and eating iron-rich foods can also help give you a boost. Section 4. Frequent urination. Feel like you've moved into the bathroom? That's another classic first trimester move. It's caused by a couple of things. First, the amount of blood in your body is increasing, so your kidneys are working overtime processing extra fluid that heads straight to your bladder. At the same time, your growing uterus is starting to put pressure on your bladder. It's definitely annoying, but it's a great sign that your body is adjusting perfectly. Just make sure to tell your doctor if you have any pain or burning when you go, as that could be a sign of a OT. Section 5. Food cravings and aversions. Suddenly have a desperate need for pickles, but the smell of your morning coffee makes you want to run for the hills? Food cravings and aversions are very real and often start early. These intense urges and dislikes are tied to hormonal shifts that mess with your senses of taste and smell. Some experts even think aversions are a clever way your body steers you away from foods that might be harmful. It's totally fine to give in to those cravings in moderation, and don't stress if a few aversions throw your appetite off for a bit. Section 6. Mood swings. Feeling on top of the world 1 minute and ugly crying at a commercial the next? You can thank your hormones for that roller coaster. Big swings in estrogen and progesterone can seriously impact your mood, making you feel way more emotional or irritable. On top of that, the stress, exhaustion, and all the physical changes are a lot to deal with. Be gentle with yourself, Get plenty of rest, and don't be afraid to lean on your partner, friends, or family. If you're feeling constantly down or anxious, please don't hesitate to talk to your healthcare provider. Section 7. Constipation and bloating. Alright, let's talk about another one of the less glamorous symptoms, feeling bloated and backed up. The hormone progesterone, while a superhero for a healthy pregnancy, also has a side gig of slowing down your entire digestive system. This can lead to gas, bloating, and constipation right from the get-go. To help keep things moving, focus on fiber-rich foods like fruits, veggies, and whole grains. Drinking tons of water and staying active with gentle exercise can also make a huge difference. Section 8. Dizziness. Ever feel a little lightheaded when you stand up too fast? Mild dizziness is another frequent first trimester complaint. It can be caused by your blood vessels relaxing and widening to send more blood flow to your baby, which can cause a temporary dip in your blood pressure. Being dehydrated or having low blood sugar can make it worse. Try to get up slowly, drink plenty of water, and eat small, regular meals. If your dizziness feels severe or you actually faint, it's really important to call your doctor right away. Section 9. Heartburn. That burning feeling in your chest after you eat? Yep, that's heartburn, and it can show up surprisingly early. Once again, progesterone is the main culprit here. It relaxes the valve between your stomach and esophagus, which can let stomach acid splash back up where it doesn't belong. To fight back, try eating smaller meals more often and avoid lying down for at least an hour after eating. It can also help to figure out your trigger foods. Spicy and fatty foods are common offenders. Section 10. Spotting and cramping. Finally, let's talk about something that can cause a lot of anxiety: spotting and cramping. It's important to know that light spotting, often called implantation bleeding, can be a totally normal part of early pregnancy. It happens in up to 25% of pregnancies when the fertilized egg attaches to your uterine lining. Mild, period-like cramping can also be normal as your uterus starts to grow. But here's what's crucial: knowing the difference between what's typical and what's not. If you experience heavy bleeding, severe pain, or cramping that won't quit, you need to seek immediate medical attention. CTA and AMP. Conclusion. And there you have it. Navigating the first trimester can feel like a lot, but just remember, most of these symptoms are a sign that your body is doing exactly what it's supposed to do to grow a healthy baby. You've got this. If you found this video helpful, give it a thumbs up and subscribe for part 2, where we'll answer even more of your questions. What's the weirdest symptom you're experiencing? Let us know in the comments below. We'd love to hear from you. Remember, every pregnancy is different, and this is all for informational purposes. Always talk to your own healthcare provider for personalized medical advice. Congratulations, and take good care.